And there we go. Dr. Goldbaum, nice to see you.
Hi, how are you?
I'm great. Thank you so much for taking the time to share your experiences with the Avison and share those with the people who are going to have viewing this thing.
Well,
Um,
Duke, I could never tell you no. You ask me, I'm showing up, buddy. It's all good.
I appreciate that. I appreciate that. Well, listen, let's start off this way. I think it'll be helpful for the viewers here to really get a little bit of an idea of your background. And I've got some information so that I'll share that as a matter of introduction, if you don't mind.
No, that's great.
Great.
Absolutely. Yeah,
Let's do
sure.
that. Okay.
Okay.
So we're speaking with Dr. Ian Goldbaum, who is a DPM, that's a Doctor of Podiatric Medicine. He's been in active practice now for 37 years. He's a diplomate, the American Board of Multi-Specialties in Podiatry. And Dr. Goldbaum is board certified in primary podiatry, podiatric surgery, and wound care, as well as limb salvage and preservation. His practice has 3 office locations in Palm Beach County, Florida, with 22,000 active patients. That's quite a practice, Ian.
I feel tired after hearing all that.
Yeah. I bet you do. I bet
Yeah,
you do. Well, this is great. I appreciate it. I'm certainly glad that you've had a chance to be working with this device and kind of share with us your thoughts on it. So I'm going to
sure.
ask a series of questions here. So first of all, let me ask you this: as a podiatric physician and surgeon, when you discovered the Avicen device, what about it intrigued you and caused you to want to really evaluate this device with your patients?
Well, today we look at the technology, and the technology today in medicine, it's passing medicine. The technology is surpassing medicine. And this was a new device that I had heard about. And I said, well, you know what? It sounds interesting. I'm intrigued. I actually talked to the inventor of the Avicen medical device and found out really the mechanism of what was going on, how it functions, and how it increases the body core temperature. How, it's amazing to me, just taking the palm of one hand, Duke, and putting it into the machine and having it spiral up the heat for you to get to normothermia. And then all of a sudden, all these things trigger within your brain and your body of it. You got to dilate and get that heat away, and how it can effectively reduce inflammation and pain. That's the part that really I found interesting. The dilation part, is very intriguing to me.
Excellent, excellent. Well, that's amazing. So, listen, based on what you just shared, the fact that there's this dilation going on, and we have this thing called capillary or microcirculatory, circulation. How would something like that benefit a person? So, in other words, what would could a person expect to experience maybe as a result of that?
It's interesting because what you're doing is you're basically increasing blood flow, right? And if you think of heat and how this is working, a lot of the things in our body. Let's just take the piping for say. Let's take the arteries and the veins. Those are made up of cells, and they have smooth cells. And you heat up blood, and sometimes when you heat up blood, it'll go faster. There's a linear flow, and it'll travel faster. And when it travels faster, it gets places to get to that target that you needed to go that maybe it wasn't getting before because those arteries and smooth, they were narrowed. Just for instance, if we look at a red blood cells are about 120 days in the body. And on top of that red blood cell is a hemoglobin. Sits like this, if you will, right? And when it's going through the arteries, if there's rust in the pipes, we call that atherosclerotic plaque, it'll knock them off. So you got this red blood cell running through there, but you're really not getting the oxygen where it needs to go. So just this vasodilation, if you will, the microcirculation, if it opens that up just enough and you don't knock that off, that hemoglobin, the oxygen can get where it needs to go to those target cells. And that's kind of interesting, how it can be effective that way.
Wow. Wow. That's amazing. Of course, I hadn't heard that before. That's a little more technical than I'm used to, but I really appreciate that explanation.
I'm trying to keep it real basic. If I get a little too technical, just knock me back, buddy. I don't have a problem.
No, that's great. That's great. I appreciate it. I'm an engineer. I do understand a few things. So when you say piping, I'm like, oh, okay, I see that. So listen, you've been using the Avicen in your office, in your practice now for the last few months. What have you noticed that your patients are experiencing? Let's talk maybe a little reality now versus theory.
Okay. Well, it's interesting, Duke. People experience different things. You know that people if you put them in the Avicen machine, you know, some may do unbelievably, tremendously well. Other people, they'll notice just a little bit. Everybody is independent of everybody else. Everybody's a little bit different in their body. Everybody's different on their chronic pain that they're experiencing. So, you know, when patients have chronic issues, and I have a lot of patients with chronic issues, you know, arthritis, neuropathy, just to name two of them, I can say with confidence, if you get the blood to the area, the blood is a lifeline. Bottom line. Think about it. What's the microcirculation doing, dude? It's carrying oxygen. It's carrying the nutrients. That's its job. But what also is it doing? It's taking away carbon dioxide. It's taking away the toxins at the same time. So you have to allow the oxygen to come in, and you absolutely have to take that carbon dioxide out for it to actually hit target and for it to work well. And that's what the Avicen device, I believe, is doing.
Wonderful. So, and you're saying in the capillaries as opposed to the arteries. So just so our viewers can really understand,
okay,
the way I understand it, the capillaries and the microcirculatory system really make up 74% of our circulatory system. So
right.
it kind of like represents the last mile, you know, taking it from the main distribution points out to the extremities. Is that a correct something?
Absolutely. It's hitting the target areas. You know, you're jumping out of the big pipes to the micro pipes, so to speak, that linear flow. You know, that's what decreases the pain and speeds up the healing process. You've got to get that microcirculation to the area. That's what does it. That is actually the key. That's a big deal.
And okay, excellent. So that's what you've had patients experiencing. Have you had any patients that have had, you know, any anecdotal evidence like that have experienced, you know, significant, you know, pain relief and, you know, maybe even does it affect what kind of prescriptions they're taking and that kind of thing?
Yeah, you know, that's a wonderful question because, you know, we've got an opioid crisis in this country. Not that I'm going to talk about it because everybody's pretty aware of it. And it's ruining families and it's ruining the people that are on it. And that's what I really like about this device, because you're doing something that has no contraindications that we know of. You know, it really is a great device for that. So, you know, I do surgery. I do reconstructive surgery of the lower extremity. And when I got the machine, what I started doing is I started pairing it with something called stem cell and with the Avicen. Now, the Avicen comes in post-surgical. I let the patient use it for 3, 4, 5 days. And when I do a bandage change, for the first time, I'm not seeing swelling, which means that the stitches themselves aren't pulling. If the stitches don't pull, the patients don't have as much pain, right? The other thing that's important is the opioid use. We've gone from giving an amount of opioids, whether it's oxys or whatever, Percocets, we've decreased the amount substantially with the utilization of the Avicen machine. And that's tremendous. I mean, what doctor wouldn't want to do that? You know, forget about the pains. What about the stuff that opioids do to your GI system? People not being able to move their bowels, et cetera, and so forth. I mean, it's a big deal. You know, out of this little machine that's about the size of a bread box, you know, it's a pretty good technology, you know, with that. You know, I want to share with you a story. This was interesting. I have a lady that came in for some work, and she was in a head-on car collision, okay, a drunk driver. This is about 10 years ago, dude. And she's had chronic pain since. She takes 4 Percocet a day for breakout pain, a fentanyl patch of 75 milligrams. I said, look, you're having this chronic pain. She's not happy. I said, why don't you take home one of these machines? Well, by the 3rd day, she noticed a difference. There was a reduction. It wasn't all gone, right? By the 12th day, oh my God. She came in crying. She goes, I need to buy one of these machines. I said, it's made that much of a difference? She goes, Doc, I'm not taking the Percocet. That's number one. And I've knocked my fentanyl patch from 75 to 50. The pain that I'm experiencing after 10 years and going through all this stuff, this is the first thing that's actually worked for me. Now, obviously, dude, this doesn't happen to everybody. But you know, when it happens to just one person, it's worth having that machine just for that. I mean, it's pretty incredible. The microcirculation of doing that with the Avicen device made that difference in her world, which now is going to give her a better quality of life, which is what you're trying to do anyway, right?
Yeah, amazing. Thanks for sharing that story. That's unbelievable. Yeah, that's exactly what we want to see with that device. That's awesome. Well, listen, I'm gonna just ask you one here, particularly. Do you see any other applications with the device? I'm thinking, like, again, as a doctor of podiatric medicine and a surgeon, you've kind of shared a couple of those things, doing wound care and extremity reconstruction. What else do you see? Is there any other thing with that Avicen device that you see that's beneficial?
Well, anytime you can increase the microcirculation, which obviously this machine does, right? And we talk about wound centers. I ran a wound center for several years, hyperbarics. Well, what's hyperbaric doing? You're actually getting you're going down different atmospheres. You're increasing the oxygen content, right? And it's pretty expensive stuff. I mean, these can be $1,500 a treatment. You need 60 treatments to lower extremity for it to work. If you put a patient in Avicen as part of an adjunct of that therapy, I mean, they can take it home. They can keep this thing going. That's the thing that's interesting. Not only can they just use it on their own, they don't have to be in the office, but here's the thing. It doesn't weigh 400 pounds. It's not a chamber, where they can't take it. And it's not going to cost them $1,500 every time they use it. And they can use it 2-3 times a day, even 4 times a day, depending on what's going on with their life. I mean, they're the ones that actually set the bar, if you will, how much they want to utilize it. And that's a big deal. You get to target that pain and inflammation. Wounds, listen, when I do wounds, what's the number one reason they don't heal? Circulation. They don't get oxygen to the area. So when I'm doing a wound and I do the debridement, or I'll put a graft on, I put them with the Avicen machine. They're going home with it. We're seeing these things close up.
That's amazing.
It is great.
Wow. Boy, I sure appreciate your time. This has been great and some really, really great information. Is there anything else you'd like to add at this point?
Well, Duke, it's a class 2 FDA clear. FDA clear is huge. People have to know that it's a real device. It's gone through the scientific levels. It's the real deal. Okay, and the government looks very closely at this stuff. There's certain parameters you have to hit, and they were able to do this when they were doing the device, and that's big. And we tell people when you have chronic pain, and you and I, thank God, we don't have that. We have some aches and pains, what this will work for, but the chronic pain is the big thing. This is a wellness device. This is just not pain management. This is a wellness device. Patients can use this several times a day. They can increase their blood circulation, the oxygen, as a wellness device. And today, with everybody looking at their diets, running, going to the gym, this is just part of that regimen, which I think really helps people. We want to be healthier as human beings. Once again, technology surpasses the medicine. Health is wealth. And in my just couple of months of using the Avicen medical device, I've seen some changes with these patients. And it's really a great thing for me to have in my office. Not only can I knock down the opioid use, not only can I knock down the pain, not only can I knock down the inflammation, but I can give a quality of life back to the patient much more than they had previous to having this device.
Wow. Amazing. Well, gosh, thank you so much, Ian. I really appreciate it from your perspective and what you do and how long you've been in practice. Really appreciate the evaluation. Thank you so much.
I appreciate you allowing me to come on, because if one person sees this video and it changes their life, then you and I, we pretty much did our job, right? Using the technology of a video, right?
You bet. You bet. Thank you so much. You take care.
My pleasure. You too.
Bye-bye.
Bye.